Hello everyone, my name is Callie Bassett and this is my video presentation for an innovative mental health mobile application for Brandman University class DNPU 702, Innovation in Technology and Information Access. Why is mobile technology important in the mental health field? Who does it benefit? Who does it affect? What does it change? Many mental health patients are non-compliant with treatment. One noted reason by Steinbox et al., researchers who evaluated the effectiveness of web-based tools to enhance communications between patients and doctors, is that many patients are frustrated with the services they receive because they feel rushed during visits, not being able to express their issues fully, and feel they have no voice in their own treatment regime. This is an issue for mental health patients across the United States as well as other areas. Two recent studies were conducted in England and Finland. Kwape, Hutton, Adams, and Villamaki, 2015, found that patients overall felt they would be more apt to adhere to treatment plans if they were involved in constructing the plans and their needs were better addressed. Thompson and Doody, 2015, conducted a study that showed treatment adherence fails because patients and doctors have a different perception of what is important for outpatient care. This problem affects both clinicians and patients and disrupts the therapeutic milieu. Non-compliant mental health patients result in increased hospitalizations and often increased negative incidents in the community. If patients were to have a voice in their care, patient satisfaction could increase along with compliance as well as their overall mental health. According to the Journal of Medical Internet Research, benefits of mobile mental health applications are provision of psychoeducation, reduces stigma, supplements and supports therapy, self-monitoring, enhances provider and patient communication, and enforces patient empowerment. According to the JMIR, approximately $113 billion is spent yearly on mental health treatment. Most of this money goes towards prescription medications and outpatient treatment, which makes it all the more important to find ways to encourage compliance with the mentally ill. Depp et al. 2010 conducted a preliminary study on 3 mobile technology approaches with the severely mentally ill. They discussed that greater efforts need to be made to reach out to the severely mentally ill patients in efforts to get them to comply with treatment, since so many resources are being utilized on the mentally ill yearly. Such efforts as increased telephone calls and home visits have made some impact but not enough. Often the duration of time in between these efforts have made them ineffective. With new technology such as mobile applications, if needed, patients can have some form of communication daily in regards to their mental health issues. Granholm et al. Concluded from their pilot study that relatively long-term use of mobile technologies to assist in the assessment and treatment of people with serious mental illnesses is feasible and holds great potential. The 3 main collaborators I worked with when searching for a mental health application were Dr. Kevin Turner, Anita Hill, MSN, and Pat Barnes, DDS. Dr. Kevin Turner utilizes different mobile apps currently to keep efficient with his many practices. Anita Hill was an innovator at my former employment, always coming up with interesting ways to make training exciting, different, and always introducing new technology. Dr. Pat Barnes, DDS, owns a state-of-the-art dental office with the latest technologically advanced equipment.
Hi, I'm Dr. Kevin Turner, psychiatrist. I work in rural mental health where those around me tend to be slow to adapt to change. I work in multiple facilities, therefore mobile technology has become a must for me. Without current cell phone apps, it will be virtually impossible for me to keep up with all my patient information and respond to patient concerns appropriately while I'm on the go.
My name is Anita Hill, and I currently work as a nurse educator for 3 units here at Methodist Labana Central Hospital in Memphis, Tennessee. Mobile technology has become a very important aspect of my job. I challenge myself and others to implement new technology into the workplace whenever it is possible. Mobile technology has increased patient satisfaction here at this hospital, and I believe that it is currently due to decreasing response time of the nurses by use of cell phone interaction over the standard call line.
Hello, I am Dr. Pat Barnes, DDS. Mobile technology has allowed me to better relate to my patients and allow my staff to reach out to our patients more effectively. The use of mobile technology and advanced equipment has allowed me to see an increase in revenue in my businesses over the past 10 years. Healthcare providers that are not willing to move forward with this technology are hindering their practices.
After finding the application, I also found myself discussing it with many of my coworkers. My collaborators gave me many great tips, such as articles I reviewed, I rejoined my nursing professional society, and I consulted with 2 other recommended psychiatric professionals. The mobile application I researched was titled Common Ground. The app was developed by Patricia Deegan, PhD. Dr. Deegan is an independent consultant who lectures on recovery and empowerment of persons with mental illnesses. The purpose of Common Ground is to help persons with mental illness, self-managed psychiatric conditions, learn about recovery, and participate in shared decision-making with their mental health provider. The user needs access to the internet. The application can be used via computer, smartphone, or any other type of mobile iOS device. The app was developed based on the premises that most appointments with mental health providers are short, 15 to 20 minutes, even though there are many issues that need to be discussed. In this period of time, patients often find it difficult to organize their thoughts quick enough to ask all the questions they have, answer the clinician's questions, speak about concerns, and make decisions. Common Ground addresses this challenge by helping the patient formulate a one-page health report that summarizes how they are doing and their concerns before the appointment, and takes that information and links the patient to information about treatment and suggestions to help manage their disorder and progress in their recovery. During the patient's appointment, the health report helps to expedite reporting information to the clinician so he or she can quickly understand the patient's goals, concerns, and progress. This allows for input from both parties. The shared decision is then able to be printed out and given to the patient to take with them as a reminder of things they need to do to help themselves before the next appointment. JMIR reports that in 2012, 73% of American households use the internet, and there were 326 million cell phone subscribers and 76.9 billion applications downloaded. The 2017 projection is 3.4 billion smartphones utilized worldwide. McGuire 2007 relates that 80% of the population over the age of 5 have cell phones, and not just because they're cool, but because they are the most important way of keeping in touch with what's going on in the world. Pat Deegan was innovative enough to take into consideration mobile phone usage and incorporate that into the effort to improve mental health treatment. Christensen, Grossman, and Wang 2009 wrote that the use of technology can serve to enhance clinician interactions with patients, such as the intent of the application Common Ground. Pat Deegan has a mental illness, and she prides herself in traveling the world, giving seminars, and promoting her Common Ground application. Johansson 2006 relates that an innovative idea is not truly innovative until it is recognized in society. Common Ground is a very unique and user-friendly program, and I encourage any clinician in the mental health field to check it out.